Good evening, everyone. Welcome to Abu Dhabi Health Week. My name is Balagopal Ramdurai, and I represent Vectramind Health as CTO and Head of Products. And what we are going to show is, or what we're going to go through is the impact of AI in transforming patient experience and engagement. So we strongly believe, as a product company or a platform, we strongly believe if you can't measure it, you cannot correct it. So that's the focus on which we build the product, design the product. So let me take you through how patient experience and engagement was before we added AI into the AI capabilities into the platform. So it was, as currently it is in many organizations or healthcare providers, we have limited personalization. We're just sending fragmented communication, which means we're just sending a message, SMS or WhatsApp, without creating deeper engagement. The compliance is, of course, low because we are not targeting, we are not personalizing it. So how we are going to do with AI? With AI, we are going to have personalized care. How we are going to do with, of course, a lot of data points, a lot of data sets. We do the personalized care recommendations for the patients, and which of course helps the provider immensely because the engagement is increased. Communication and accessibility, of course, with the help of the AI capabilities, we ensure we send timely communication, not just random communications, timely communication to the patient. And of course, it is accessible for them in an easy way, multi-channel, and a channel which they are more engaged with, not just a random channel. If a patient is engaged more on WhatsApp, we can send it on WhatsApp, of course, with compliance. If the patient is more engaged on SMS or a mobile app, we ensure we send on those channels. Of course, when we use all these features and functionalities which are powered by AI, it leads to better patient engagement and, of course, compliance as well. The stat shows, the current stat on patient experience and engagement shows 65% of the patients rate waiting times as being unsatisfactory. So with the use of AI, the functionality, we ensure the wait times are minimized, of course, with the tool, and with the improved engagement, we can definitely increase the patient engagement and their habits so that they have the better stickiness to the provider. Is AI just a buzzword? Absolutely not. Is AI just a platform or an algorithm? Absolutely not. It's much more beyond that. So how we have incorporated AI into our application is what it is all about. So with AI, what we do, we send AI-driven recommendations based on the patterns, based on the patient's touch points, which we take it from different channels, multi-channels, and we personalize their experience, whether it is a pre-arrival preferences, which they want a specific, kind of a preference when they visit the provider. We have virtual assistants. Now we have enabled the virtual assistants with open AI capabilities, generative AI capabilities, which means better communication with the patients. Of course, AI chatbots part of the our offering. And not only that, it also helps in the triaging of the patient with self analysis. So we have set of questions based on the algorithm. It creates more questionnaire. It creates a loop in such a way that it gets as much details as possible so that we can analyze and give a better care to the patients once they are in the facility. Of course, the AI helps us in predictive analytics, which is the forecasting of patient flow. How many patients are likely to visit the facility on a specific day or a specific day of the week or a time, so which helps the facility to optimize their resources. And of course, we also predict based on the different data sets, the no-show rates. which will help the provider in, again, optimizing their resources and give a better care to the patients who are already there. Not only that, the no-show with the help of AI, what we do is not only predict the no-shows, but also ensure that the patients who are looking for an earlier appointments gets an appointment in an easy way. So thereby we even plug the revenue leakage over there. Then we have something called as adaptive routing in our system, which optimizes the care load across the provider, which means it's not one service delivery location which is crowded and the other one is lean. So we ensure the patients are balanced across the service delivery locations, which also directly impacts the wait time. And of course, the one area where AI can be used significantly is the feedback. Feedback, it is not a traditional feedback where you just get a feedback from the patient with a rating of 1, 2, 3, 4, 5 or a star. We run a sentiment analysis loop using the AI algorithm, which not only gives a quantitative feedback of the patient's journey and their experience, but also outlines the sentiment, whether it is positive, neutral, or negative. Although they may rate a particular journey step as 4 or 5 star, but the remark which they give in the feedback could signify a different sentiment altogether. We also are driving the patient experience with AI-driven escalations, which means if there is a compelling need where the patient experience is not so satisfactory, it will immediately escalate it to the supervisor, which means while the patient is at the facility and when we get the real-time feedback, they can go and attend to the patient who is not happy or satisfied. So this is a typical day in the life of a patient with an AI journey using Vectramind Health's firstpass. Firstpass, I would say, I can say that it's only system which covers the pre-visit, during visit, and post-visit. So most often, either the pre-visit and during visits are broken, or there is nothing after post-visit except sending a mail or an SMS, or maybe some means of communication. So we take care of the entire cycle of patient journey, right from scheduling, identification, and insurance verification, the pre-visit communication when they're going to, when they're about to come to the facility, what kind of preferences they need, whether they need a wheelchair assistance or whether they need a valet assistance or they need an attendant with specific traits. So we send pre-visit communication and also ensure that they get the preferences, what they need. And we also help provider comply with consent form management. It's a digital consent form management which helps the facility to get the consent on multiple channels. It could be on a browser, it could be on a link from SMS, or it could be on their email as well. When they click on it, opens the consent and they can give the consent form. Or it could be at the facility when they are in the the hospital. And then, of course, we have a smart check-in. Smart check-in, we have again multiple channel, right? We cover all the personas of the patient, right from a patient who is not so tech savvy to a patient who is highly tech savvy. He can do a smart check-in from just an Apple Watch. So that's the level of personalization we have we have got achieved through FirstPass. And of course, the preferences in terms of the insurance, in terms of specific criteria, we route the patient in such a way that it is very seamless for them. And of course, with the digital token, which is available on the mobile, on the Apple Watch, or on WhatsApp as well, we enable the digital token so that they can have the journey seamless. And from there, the journey management is entirely driven by AI, which means we know the route other patients have taken. Not only that, we know what kind of treatment the patient experience the patient intends to take. So based on that, we route the patient across the facility and we ensure at all times the wait times are minimized. So they don't need to wait for care and they give more preference to care times. And of course, we take the entire journey, and right from triaging to physician to um, the lab, pharmacy, and imaging. The entire process of the journey is taken care by FirstPass, and that is during the visit. And of course, post visit, which is very, very essential and important. The patient has left the facility, left the provider. So, what kind of feedback we can take from the patient? Not only that, during the visit, we have a real-time feedback loop, which means if the patient is not happy on some step of the journey, whether it is pharmacy, or they are not happy with the lab wait times, or they are not happy with the lab technician's response, so they can immediately send a feedback there and then itself, which will trigger an escalation to the supervisor while they are at the facility, which means they can go and attend to the patient there and then, ensuring the satisfaction levels are maintained. And post visit is where um, FirstPass has really worked a lot on the functionality and feature. So post visit is not just sending a communications, not just sending a feedback message. Post visit is something where we have scientifically worked on looking at patient demographic, patient the journey path, also what kind of message will resonate with them. I don't want to send a message to a person who is undergoing a treatment a message of treatment B. So it should be hyper personalized, targeted, which will make it more engaging for the patient, and of course during the course of the treatment. And of course, survey and feedback. We have both survey and feedback. Survey, we have a very anonymous survey, which ensures there are no biases in the system. And feedback is very personalized. We will know exactly what is the feedback given by the patient at any point of time. And of course, FirstPass also has an option of post-visit education, which means as a provider, they will be able to send content specific to the treatment, generic and also informational, and split across. So which means they get the content based on their treatment. The benefits of FirstPass with AI is twofold. From the patient side, what is the benefit? From the provider side, what is the benefit? From the patient side, it is hyper-personalized. The recommendations are driven with AI algorithm. When I say AI algorithm, it does not mean that we need to use a third-party cloud provider. The AI algorithm runs within your facility, which takes care of your data privacy and security, and quick and instant response. If there is a negative feedback, they get to see the response immediately from the provider. Of course, with the AI, where we balance out the crowd, the wait time is reduced, which means they don't need to wait unless there is a real compelling need. And the one thing which we have recently launched is hyper-personalized engagement, not just contextual, hyper-personalized, based on the treatment, based on the patient's path we have taken, and real-time feedback options. For the provider, we have AI-powered pathways, which improves the operational efficiency. And as a provider, they will know what is the patient preference or behavior analysis. Assuming a patient has been booking an appointment and has been canceling it, or he has not been turning up for the appointment, we as a system will know that this patient has a higher probability of canceling it or not turning up. So what we do is, in that case, we inform the scheduler to have a double booking or triple booking, which directly impacts the revenue of the provider. Then we have sentiment analysis, as I said, from the feedback, and real-time dashboard governance. We have almost 130 charts and graphs, which gives a real-time analysis and feedback of the patient across the facility, and the provider can see. And of course, we give a feedback to the provider. What are the areas they need to look into, whether it is a preventive or a corrective. Assuming you can have a patient-reported experience measure, it will exactly show where they need to look into in order to improve the patient experience. This is a sample graph of our patient journey. So it has the upcoming appointment. Not only upcoming appointment, it also has the historical appointment and the journey a patient has taken. Now, if you look at the top, it says early, a patient has come and checked in early, which means as a provider, I know a particular patient who has checked in or say who has booked an appointment is going to come in early, or a particular patient who is about to, always going to come late. So in this way, I understand the behavior of the patient. Based on the behavior that on the data churn, I will give a very hyper personalized patient pathway for him. And here you can see the patient happiness index, whether it has changed, whether it has gone up or has gone down compared to the previous visit for the patient. So this is FirstPass, the very holistic patient experience and engagement platform. Starts right from scheduler, which allows scheduling, multi-channel scheduling, covering OPD, admissions, and daycare. It has state-of-the-art features like waitlist management, fast-track management. Then we have the KYP, Know Your Patient. If the patient has certain documents missing, an insurance or an Emirates ID or a national ID, they have an option to upload the document across, again, multiple channels. Then we have the consent form, a digital form, using which provider can obtain the consult and the compliance. And then we have the entire FP flow, which is a patient flow management. This enables the patient to go through the path of journey, path of treatment in a very efficient way. And as I mentioned in the previous slide, it helps both the provider and the patient seamlessly. Then we have a solution module called FP Engage, First Pass Engage. This is for patient communication, highly configurable, again, multiple channel. This engagement module will help the provider in sending hyper-personalized messages to the patient in an automated way and also in the manual way across the channels again. Then we have Livecast, which is a real-time dashboard, which has 130 odd dashboards, charts available, and then feedback, which is for sentiment analysis, and knowing the feedback of the patient. And then the last we have Escalate, an engine which will escalate based on certain thresholds. And if you really want to have a look at our the product and demonstration of the product, please visit us at 5B28, just right here, and we'll be more than happy to give you a demonstration.